Hello and welcome. I am Alfred Gatt, and together with my colleague, Dr. Stephen Mitzi, we will be discussing how state of the art technology could today be used in order to investigate and manage various foot pathologies such as metatarsalgia, which will be the case study in this presentation. We will be focusing on the use of technology in podiatric biomechanics more than the clinical aspect per se, in order to introduce these technologies, which for some professionals may be new, while others may be more familiar with them. We hope that these examples will be stimulating and beneficial towards your profession. The objectives of this presentation is to provide experienced clinicians with advanced theoretical presentation of metatarsalgia so as to be able to arrive at a differential diagnosis, to introduce participants to latest innovative technologies for the examination of the foot, which are not commonly found in daily practice, to provide participants with up-to-date information about new and innovative technologies for the treatment of forefoot conditions, which are not commonly found also in daily practice, to induce an inquisitive attitude amongst clinicians in order to be autocritical so as to be able to adequately assess their treatment methods. The technologies which we will be discussing within this presentation are diagnostic ultrasonography, which is an important imaging technology which will aid in the diagnosis of the presenting complaint, platform pressure mapping technology, which is also very important because most of the etiological causes of metatarsalgia are related to pressure. Computer-aided design and computer-aided orthosis. We will be looking at two different types of technologies, which are subtractive manufacture or milling and additive manufacture, which is 3D printing. Also, in order to check whether our treatment is being effective or not, we will use in-shoe pressure mapping technology. So, as to the presentation of the case study itself, a 49-year-old female presented at the clinic complaining of pain in her right metatarsal area following activity or use of fashion footwear. She also complains of occasional numbness in the toes. She had been recently diagnosed with hypertension and advised to increase her activity levels as a control measure, which she did for the past 2 months. The use of oral non-steroidal anti-inflammatory drugs, which were diclofenac sodium, offered only temporary relief. However, this recurred when the drugs were stopped. For those who are not familiar with the condition, metatarsalgia refers to pain in the metatarsophalangeal joint area, that is, the ball of the foot, which may be acute, recurrent, or chronic. Several pathologies may present this pain, thus it is of utmost importance to correctly diagnose the underlying cause of pain. Therefore, metatarsalgia is a symptom, not a diagnosis. So the term itself of metatarsalgia does not really tell us what is the presenting condition, the presenting pathology, but rather how it presents as a symptom. There are multiple causative factors that lead to the development of metatarsalgia, some of which are related to foot and ankle deformity. Trauma is another common cause of this type of pain. Fundamental etiological component of metatarsalgia is the repetitive loading of a locally concentrated force in the foot during gait, namely repetitive stress, usually due to pressure. So, some common causes of metatarsalgia includes trauma, as we have already said, the arthritides, so the different types of arthritis that affect the metatarsophalangeal joints, foot types including deformity, footwear, namely ill-fitting footwear such as high heels or narrow footwear, and the footwear with the sole which is not perfectly smooth. There are gait changes that can cause metatarsalgia, foreign bodies, change in activity levels, and also mechanical causes. So there are a number of different causes of metatarsalgia. So arriving to a differential diagnosis will not be very easy. And that is one of the reasons, for example, why we need to use technology in order to remove the guesswork from our differential diagnosis when two different conditions appear to be almost the same. So, some of the conditions that can cause pain in the forefoot include tylomas or corns, hyperkeratotic lesions, verrucae, some dermatological lesions, stress fractures, capsulitis, neuromas, intermetatarsal bursitis, plantar digital neuritis, Freiberg's infraction, plantar plate rupture, rupture, sesamoiditis, infection, arthritis, tendon pathologies, non-neoplastic tissue masses such as ganglia. The list is very, very great, and we will be attaching a list with the study material for this case study. So please do look at this study material.